Section 1. Introduction. The body's chemical messengers. The endocrine system is a complex network of glands that work together to maintain balance, or homeostasis, within the human body. These glands produce and release chemical messengers, hormones, directly into the bloodstream. Unlike the nervous system, which sends rapid electrical signals, the endocrine system sends slower, more sustained messages that travel throughout the body. Hormones act on specific target cells and organs, influencing a vast array of physiological processes. Understanding this system is essential for safe patient care, and it's a major topic on the Nclex. Hormones are powerful regulators of daily life. First, identify the major players. Pituitary gland, the master gland at the base of the brain. Thyroid gland in the neck, controls metabolic rate. Adrenal glands resting on the kidneys, manage stress hormones and electrolyte balance. Pancreas behind the stomach, crucial for blood sugar regulation. Parathyroid glands on the posterior thyroid, responsible for calcium regulation. Section 2. The pituitary gland, the master conductor. The pituitary gland, a small pea-sized structure nestled securely at the base of the brain, holds the distinguished title of the master gland. The pituitary is divided into two main parts: the anterior lobe, the posterior lobe, each with its own set of responsibilities, which stores and releases a critical hormone known as antidiuretic hormone, or ADH. Antidiuretic hormone, also known as vasopressin, plays a vital role in maintaining the body's fluid balance. Its primary job is to tell the kidneys how much water to conserve. When the body is dehydrated or blood volume is low, the pituitary gland releases more ADH. Conversely, when the body is well hydrated, ADH levels decrease. This delicate feedback loop is essential for regulating blood pressure, blood volume, and serum osmolality, which is the concentration of solutes in the blood. Disruptions in the normal secretion or function of ADH lead to two significant and opposing clinical syndromes that are frequently tested on the Nclex: diabetes insipidus, the syndrome of inappropriate antidiuretic hormone. In DI, there is a deficiency of ADH, causing the body to lose massive amounts of water. In PSI-ADH, there is an excess of ADH, causing the body to retain too much water. Memory tip: too little ADH equals diabetes insipidus. Too much ADH equals PSI-ADH. The thyroid gland is a butterfly-shaped organ located in the front of the neck, just below the Adam's apple. It produces two primary hormones, triiodothyronine, T3, and thyroxine, T4. These hormones are released into the bloodstream and travel to nearly every cell in the body, where they regulate the speed at which the cells work. Essentially, the thyroid acts as the body's internal thermostat and engine. Proper thyroid function keeps energy levels steady, weight stable, and overall vitality. Hyperthyroidism happens when the thyroid makes too much hormone. The most common cause is Graves' disease, an autoimmune disorder where antibodies mimic TSH and push the gland into overdrive. That fast metabolic state causes symptoms: weight loss despite a big appetite, heat intolerance, excessive sweating, racing heart or palpitations, anxiety, irritability, and a fine tremor in the hands. A classic sign of Graves' disease is exophthalmos, which is the bulging of the eyes. A life-threatening complication is thyroid storm, or thyrotoxic crisis. It can be triggered by stress, infection, or surgery. It causes extreme hyperthyroid signs: very high fever, severe tachycardia, hypertension, agitation, and delirium. Nursing priorities: reduce temperature with cooling blankets, give beta blockers like propranolol to slow the heart, start antithyroid meds such as methimazole or propylthiouracil, and provide supportive care with IV fluids and oxygen. Hypothyroidism is the opposite: too little thyroid hormone. The common cause in iodine-sufficient areas is Hashimoto's thyroiditis, an autoimmune attack that destroys thyroid tissue. Slow metabolism leads to unexplained weight gain, profound cold intolerance, persistent fatigue and lethargy, and a slow heart rate. Patients may also have constipation, dry skin, dry brittle hair, and depression. Treatment is lifelong levothyroxine, a synthetic T4. Important Nclex rule: take medication in the morning on an empty stomach at least 30 to 60 minutes before breakfast for optimal absorption. Severe complication: myxedema coma, hypothermia, hypotension, respiratory depression. Treatment: IV thyroid hormone and airway support. Perched like small caps on top of each kidney, the adrenal glands are two distinct glands in one, composed of an outer cortex and an inner medulla. For our Nclex focus, we will concentrate on the adrenal cortex, which produces vital steroid hormones, primarily cortisol and aldosterone. Cortisol increases blood sugar through gluconeogenesis, suppresses the immune system, and aids in the metabolism of fat, protein, and carbohydrates. Aldosterone tells the kidneys to retain sodium and excrete potassium, managing blood volume and blood pressure. Cushing's syndrome results from chronic exposure to excess cortisol, due to adrenal or pituitary tumors, or more commonly, long-term high-dose glucocorticoids like prednisone. Symptoms: central obesity with thinning arms and legs, a rounded moon face, a buffalo hump, fragile thin skin with easy bruising, purple abdominal striae, hyperglycemia, and hypertension. Nursing priorities: monitor blood glucose, protect from infection, and provide meticulous skin care. In direct opposition to Cushing's is Addison's disease, or primary adrenal insufficiency, usually autoimmune destruction of the adrenal cortex. Symptoms: fatigue, muscle weakness, weight loss, hypotension, and hyperpigmentation, especially in skin creases, on the elbows, and on the gums. Labs: hyponatremia, hyperkalemia, and hypoglycemia. Addisonian crisis presents with severe hypotension, tachycardia, dehydration, vomiting, and abdominal pain. Requires immediate intervention. Priority treatment: rapid IV hydrocortisone and aggressive fluids with 0.9% saline plus dextrose. Memory aid: with Addison's, you need to add some steroids. With Cushing's, you have an extra cushion of cortisol. The pancreas is a unique gland. It has exocrine functions related to digestion. It also has endocrine functions critical for metabolism. Its endocrine role is carried out by the islets of Langerhans. Beta cells produce insulin, alpha cells produce glucagon. Insulin acts like a key unlocking cells, allowing glucose to enter for energy. This lowers blood glucose. Glucagon does the opposite, signals the liver to release glucose, mainly between meals or during fasting. Type 1 diabetes is an autoimmune disease. Immune cells destroy insulin-producing beta cells. Without insulin, glucose can't enter cells. Glucose accumulates in the blood. Hyperglycemia. The classic symptoms are the three polys: polyuria, polydipsia, and polyphagia, with weight loss. Diabetic ketoacidosis. Rapid fat breakdown produces ketones leading to metabolic acidosis. Signs: very high blood glucose, ketones in blood and urine, a fruity breath odor, and small respirations, deep, rapid breaths to blow off CO2. Management priorities: rehydration, insulin administration, and electrolyte correction. Give large volumes of 0.9% normal saline. Start a continuous IV infusion of regular insulin. As insulin moves glucose into cells, potassium shifts intracellularly. Monitor and replace potassium as needed. Nurses must do frequent neurological checks and monitor blood glucose hourly to guide therapy and prevent complications like cerebral edema. To succeed on the Nclex, you must be able to quickly recall and differentiate between key endocrine disorders. This section provides concise, high-yield lists designed for rapid memorization and last-minute review. Use these lists to build mental frameworks that allow you to quickly identify a patient's condition based on a cluster of signs and symptoms. Hyperthyroidism equals fast, weight loss, heat intolerance, tachycardia, anxiety. Hypothyroidism equals slow, weight gain, cold intolerance, bradycardia, fatigue. Too little ADH equals diabetes insipidus. Too much ADH equals SIADH. DI. Dry inside, polyuria, very dilute urine, hypernatremia, treat with desmopressin and fluids. SIADH. Soaked inside, low urine output, concentrated urine, hyponatremia, treat with fluid restriction, hypertonic saline if severe. Cushing, moon face, buffalo hump, central obesity, hyperglycemia, hypertension. Addison, weakness, weight loss, hypotension, hyperpigmentation. DKA, hyperglycemia, ketones, small breathing, fruity breath, treat with IV fluids, IV regular insulin, and careful potassium monitoring. Mastering the endocrine system for the Nclex and for your future nursing career is an achievable goal that hinges on a structured and focused approach. Summarize that understanding hormone function, symptoms, complications, medications, and nursing interventions is essential for answering endocrine system questions on the Nclex exam. Your confidence will grow as you connect imbalances to logical consequences and prioritize care. skills that help you conquer the Nclex and care safely at the bedside. Keep your focus sharp, your review consistent, and you'll be well prepared for any endocrine challenge that comes your way.